Hello. For a lot of people, coming into hospital for an operation can be daunting, but we believe if you know what to expect, you'll feel far more at ease and won't worry as much. This video will talk you through what's likely to happen on the day of your operation. Your appointment letter will state the time you need to arrive in the hospital, or the admission time. This is not the same time as your operation, which could be much later in the day. Go to the location listed on your letter. This may be the ward, the surgical unit, or the admissions unit. Give yourself plenty of time to get across the hospital from the main entrance, and please let us know at the pre-op appointment if you'll need a porter to assist you. You may want to bring someone with you to the hospital. Unfortunately, due to the limited space, they'll not be able to stay with you beyond booking in at reception unless you need assistance due to a specific medical condition. When you arrive, check in at reception. The receptionist or ward clerk will take your details and confirm your identity. An identity band will be attached to your wrist and sometimes your ankle. You'll be seen by one of the nurses, who may take your blood pressure, pulse, temperature and oxygen levels. At some point prior to your operation, you'll be seen by the surgical team, either the registrar or the consultant. They'll confirm that you're happy to proceed with the operation and will complete the consent process if this hasn't been done before. This is a good time to ask any final questions. You'll also be seen by the anaesthetist, who's the specialist doctor in charge of providing pain relief. They'll talk to you and decide if you'll be awake or asleep for the operation. After your operation, you'll be taken to the recovery room, where you'll be looked after by a specialist nurse who will monitor you and provide additional pain relief if required. You usually stay here for less than an hour, but it may be longer after more major operations. If you've had a general anaesthetic, you may not remember this period of time. Once the nursing team are happy that you're stable, you'll be taken back to the ward. Most people will be able to go home the same day, but others will need to stay in for a day or more. If you have to stay in hospital, you'll be seen on a regular basis by the surgical team, who'll check that you're recovering well. You'll be discharged once the team are happy that you're well enough to cope at home and assure that you have someone to help you out if required. If you have any questions about the day of your operation, please speak to your GP or the specialist nurse at your pre-op appointment.